Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I have something we'll talk about this morning is restoring function by returning the arch form back to normal as best we can. Now this doesn't just bring function back to normal automatically, so I don't want you to think that. There's a lot of habits that have to be broken, and it takes some it's convincing of the patient that they need to start doing these things to breathe correctly and swallow correctly. And it's sometimes the breathing is a real problem, and you have to see an ENT person and maybe have allergies and have other problems in here mixed with it. But if you don't have the form of the mouth where they can function normally, then it doesn't help too much. So we can make the form fairly normal. Not as good as the tongue can make it by swallowing correctly and pressing forward and pushing out on the inner walls of the mouth, and the cheeks pulling in and the teeth coming in between the two layers of pressure there. That makes the normal form for that particular person, and they have to be biting together, swallowing properly. If they swallow improperly and you haven't trained that, they don't bite too when they swallow. You can kind of do that. I've shown people how to do that so much it's hard. People can't really just haul off and learn that. But if you put your tongue up in the front and try swallowing without biting your teeth together, if you're an adult, it'd be very difficult for you to do. So anyway, let's get on with this case. It's the material is very interesting and very necessary that we know this if we're going to be working with young people or even older people. We need to understand this. So we'll look at this young lady. This is not the best picture in the world, but she's got her mouth open. She's not a chronic mouth breather, or she would have a longer third of the face in here. She's got a fairly normal facial structure. She's looks kind of like she's off in another world here, but actually she's quite a nice young lady, and so we'll go through with this. I don't have very many facial pictures of her, but we'll look at her teeth, and they're in a god-awful mess. I mean, she has a class 2 problem, a deep bite problem, and a crowded problem, and the whole arch form is just not normal. In other words, she could not be breathing through her nose and swallowing correctly and have a mouth form, arch form like this. Now, looking at it from the side, it's in a problem too, and you look at it. If you can correct the function of this case and you can straighten it up, then your retention will be easy. But if you don't correct the function, you've got a problem the rest of their life and the rest of your time in dealing with this young lady. Okay, so let's look at the other side, and this just as big a problem as the right and the left sides, and we've got a class 2 problem, and it's a case. So you need to get at what caused this to happen in the first place. And to me, she didn't inherit this. If she did inherit it, then her parents had the same problem that developed their mouth that way. So this is something that's brought about by improper function. And now let's take a look at the upper arch. There is no way this arch would be shaped like this if she were swallowing correctly and the tongue was pressing up inside this and pushing it out. That's the only reason that anybody's teeth or the mouth form is like it is and the torque is like it is. The way the tongue presses in here determines the torque in these centrals and laterals in the anterior teeth, and the way the lip holds them back, and these teeth have to go in between that layer, and for that person that's normal. I don't give a darn what the cephalometrics tells you or anything else. If you get those teeth in the right pressure position, they are stable. They really are. And they'll tend to go to that anytime. Now you can enlarge it and make it better and get them functioning in that position, and it lasts a lifetime. So I hope you will learn to do this if you don't know already. I'm not assuming that you don't know this. I have no idea, the people that look at these, what knowledge in orthodontics you have. But here is the lower arch. Now it's wider than the upper arch simply because the tongue has stayed down here. You see the tongue in this area of the mouth right here. And this arch is wider, not a great deal, but it is wider and the tongue fits in there. If we go back and look at the upper arch, you see how narrow it is. All right, let's we got to rush on through this or we take too much time with it. We're using step-down arches, and we've got stuff on step-down arches where you come along, you line up these teeth good and put that's about an 016 or 018 wire. They're a round wire, and I don't normally drop it down that far, maybe something like this, and you come up over here. You got to get you can't just run a wire straight across here, or the occlusion will just beat it to death in here. So you drop it down on these gaps going across them. Now the step-down arches are really a wonderful functioning arch wire that if you don't know the use of them, you really should know it. Like you can take up space or you can increase the space with a step down by simply moving this leg out and moving this one out. And then when you do that, this part down here, the bottom part, will have a little bow to it. And when it does, this bow makes this go back here, and it makes this leg tend to come up. And so when you push this apart with this step-down arch, this raising up of this part tends to push the root forward along with expanding the crown. See, so your roots move with your crowns, whether you're expanding with a step down or whether you're retracting with a step down. It doesn't matter. So you really need to learn how to use the step down arch properly. Now when we are retracting with them, the back part of it, we'll make something like we'll come around, let's see, we'd have to come back, this go down and come back and come down here, and that leaves you something to tie back. So if you're pulling this back, you need something to hold the tie wire to it. So see, I didn't remember exactly how I did that, but you where this comes out of this deal, you just kind of come out and circle back and go down with it like that. Okay, that's another add-on that I stuck in with this, not to take up too much time with it. The primary thing I want to show you is get the shape and the form like it normally should be, and then you can train the person, or if the person is interested in restoring and getting their teeth fixed up, which most of them are. Now this was back in the early 70s, and this is going to be a total bandit case, but the principle, it doesn't matter. It's going to be the same 10 years from now, see. So it's up to date as far as the principle, but you'll be using brackets on these teeth, which is has a lot of advantages also. Anyway, the principle and what's happening is the same. It's been that way for years. It's going to be that way for more years. We may have better ways of doing it, but the same principle is there. I was looking in the paper the other day, the Wall Street Journal, it showed the head of somebody they said was 3,800,000, I don't know, it was 3 million years ago. I mean, that's a million has 1,000,000 in it. That was a long time ago. They think that's the key to where we change from other forms, however you believe. Anyway, that was an interesting thing. It did interesting to me. So here's this step-down arch, and we tend to widen it, and you can use the step-down as an intruding wire and open the bite with it. You can also start doing the class 2 correction that way. So I'm going to go through it pretty quick. A lot of this is just normal stuff. Now, watch this arch wire. This arch form. Watch it develop out as we go through this case. And this can happen. It doesn't matter. They can be adults that have screwed up and left this alone. And this should be treated as quick as you see it. It's ridiculous seeing things like this say, when should you start orthodontics? That's a stupid statement. Really, you should start it when you see the problem. And function, if you can start it the day it starts, it would be great. And it's ridiculous to sit around and say, well, we are not going to go in here and mess with this case until they're 12 years old or they're 14 years old. I had a patient right back the other day. They wanted to get something done early on their daughter, and they went to 5 or 6 people that did orthodontics. And none of them started the case early. They told her she'd have to wait longer. And that is so ridiculous. So I hope that we can change this thing. And I want you to join our group and subscribe to it. And we want to change this where people will start the case as soon as you see the functional problem. You should start working on it if you have that to do. Now, as we widen this tooth, you see how it's leaning over here. You need some buccal root torque. In other words, that molar should be spread out, but it ought to be level. In other words, its roots would be going ahead of the crown here. That tooth's leaning, and this tooth is leaning out already. In other words, you got teeth like this, and you're going to expand them. If you just expand without putting any buccal root torque, the roots go in even more. And we're trying to restore the airway up above, and you've got to bring these blooming roots out and spread this airway out. Now you watch where this goes to. There's a lot to this case, and it's a relatively simple case to me, but now we've got rotations there, no problem. We know how to wrap that chain around them. We can spin any kind of tooth going, unless it's ankylosed, and we can break it loose and still spin it. So that's what we're doing. Now we're going to do some expansion on the lower, though the lower was more expanded than the upper was, and we'll see it. Now this is a banded case, which we have to put more torque into this, and we take it out and close all this space. We still want it to be torqued properly. We're still using this step-down arch in here while we're letting these teeth develop in here where we can band them. I'm getting kind of choked up here. Can't talk very long without a problem there. Now this step-down arch is excellent and learn how to use this blooming thing. It's a little harder than you think. Getting this not to press on the tissue back in here or here, just needs to be laying right over the tissue but not putting any pressure on it, and it works good. And then we'll come back and band these teeth too. When it gets these teeth erupt into the mouth far enough, we'll do that. Okay, this is a step-down arch, and things are looking better. We're expanding the upper, bringing it out some. You see these cusps are getting closer, and we're going to bring this together. Now your battle is not won by straightening the teeth out. That's not the only thing. You've got to train this person and get this person interested in having a good set of teeth that are going to be with him for the rest of their life. You know, it makes a big difference in their life. So there's a lot happening. You see where these cuspids, we're going to have to kind of line that up like that, see. So we'll have to close this space and leave this, but we're going to widen this whole thing out. That's just regular orthodontics. People can learn that, but it seems like it's difficult for people to learn that you got to find out what caused the blooming problem to start with. If you don't, and you don't attack it and get rid of the problem, then your battle is going to be difficult. Continue with this case. Okay, now here we're on the lower, and you can see where the step down is. You can bring this out and work with it, and you can control this space in here with this. But I've got 3 teeth in it over here and 2 on this side right there. Now, here we're getting pretty close. We've got this arch form expanded out pretty much, and I think this may be a rectangle. I'm not sure whether that's a rectangular arch or not right there, but we need to get in that rectangular arch and get this buccal root torque and bring these roots of these teeth out, and that increases the palatal airway up above, and that's got to be done. In other words, we're in there to get function normal, but you can't normalize function if you're putting it in a position that's not normal. So you can make the facial structure fairly normal, but then you've got to convince the person what's happening. It looks like we're getting along pretty good there. And this is widening out. This is getting better across here. It's not perfect yet, but we're going to close more of this space, and that'll bring that back. And the central part of this ought to be moved over a little, which it should, in there. All right, the bottom is together now, and pretty normal, and the tongue's fitting in there pretty good. And it's, if they get that person swallowing right, that tongue is going to go up in the palate and press on it every time you swallow. And as you swallow, you bite your teeth together for normal swallow. And that controls the vertical height of the lower third of the face. And somebody that's not functioning normal has a different height of that. Okay, here is the cephalometric, and this was 1974, and we'd been going for some time here. And you see this wisdom tooth tilted over. Now, wisdom tooth like this, a lot of times we can put a separator in here and pop it underneath there, and sometimes if we can't get it up between there, we'll just tie the dental floss together right in this area, and it'll push this tooth back, and there'll be a space in here. Then you take it out and it can come up further. Then you may have to put another one, but I've walked in a lot of second molars or wisdom teeth like this. This one is okay. The uppers will come on down without any problem, and I don't know exactly how old this young lady is right now at this point. And here's 1975. Apparently we got this in. We've taken everything off, and we've got just the upper. So we're finished with our doing the work, and we'll put a retainer in there. And even though I've got a band on this tooth right here, I'll still put a retainer, and we can close this space here by taking up the wire on the retainer. It comes around here. We'll squeeze that, and it'll pull that together and lets this tooth come down better, where you close all that space, but you leave the teeth free to run into each other, and they correct that. And the overjet and overbite is fairly good apparently at this point. Now, here's what it looks like, of course, when we started, and there it is after we were finished. Now, the midline is not exactly on, but these teeth may be a different size, and these, you may have an oversized lateral or something, so I don't let the midline govern. It's how these cuspids are coming in. It's not perfect, and she's not brushing good. You can see the gingival tissue and the irritation around the edge of it, and a lot of people brush. If they're right-handed, these teeth will be better over on the left side of the mouth than the ones on the right hand. It seems like they can brush this way, but then they don't go this way. And a lot of times they'll leave this spot right in here. So we teach people how to brush their teeth better. Now let's see. Now here's the way the side looked, and this is the way it is now. So the class 2 relation, you know, we had a big overjet. The lower jaw is moved forward. This is good. Now you see this cuspid coming down. This is fitting in there, and you have to have retention that will allow the teeth to erupt together, and they have to work this relationship of meeting each other out in the mouth. You can't. God hadn't made anybody that can put something on a tooth down here and put it where it's going to be when you get through. The finishing of any good orthodontic case is done in the retention. And these little shell things do not let that happen. And so they're cheap. They don't. And so people just make them and give you a couple of those things. They keep the teeth lined up, I'll agree to that, but they're the same thickness all the way around, and they do not allow the teeth to erupt into one another, and that is a mistake. I tell that to anybody. I don't like to get too many people mad at me, but you cannot put anybody in those shell retainers and have their teeth come together properly. You've got to put some type of retention in there that, you know, we come around and make a bowl like this, and then we solder this with a heavier wire back in here, and these teeth are free to erupt, but they can't move buccally or lingually. They can go together though, and that's the way to finish them. And then you put a bite plate and hold the depth. In other words, keep this over bite and over jet the same, and that may be backwards to that. So I harp on that all the time, and if you listen to any of these videos, you'll know that. And here's this side. You see the difference in the teeth right there? And watch what now we have restored the functional shape of the mouth that will allow them to breathe right and keep their swallow right and do all these good things right. But you have to encourage them. If they've been breathing through their mouth and swallowing wrong, you've got to watch and make sure they're doing that correct. I could have done this a little better. This tooth is up here, so you can reduce the occlusal right here and make that look a little bit better there. And here's the upper arch, and watch what it looks like now. Look at that. Well, I don't know that you may be closer to it or not. Anyway, it's not that much bigger than that, but it's a good bit. You look at that. I should have got them both lined up the same way, but this is a whale a lot bigger, and the tongue can fit up in here now. If they're swallowing real good, you don't see this hump in here. The tongue push that in, and if I bring these teeth out or the buccal out, they're brought out a good bit, and you develop the airway up above. Even if they're allergic, if you get the airway big enough where the tissue can't swell up and close it out, that helps too. So anyway, this is orthodontics, and I hope that people will realize you can do this to people. It doesn't matter how old, but this idea of when should you start orthodontics, that is a stupid statement. You should start orthodontics when you see the problem developing in there. And if the person who you're doing orthodontics on, if they nurse naturally, they tend to develop their airway and everything else. You can't, while you're nursing, you can't breathe through your mouth. That's a cinch. So I feel like that we create a lot of problems by what we have learned to do, and we can't change the whole society, but we know what part of it is. And I have seen in schools in Africa where every kid had straight teeth in that particular school. It was a pretty good, had a pretty good enrollment in that school. So anyway, here's the young lady, but this is the same lady we started with, and I hope that she, if you could find this young lady, I'd like to see what her teeth look like today. And we'll go back here, and you see what this arch, in other words, you make it as near normal as you can and try to get them functioning normal. So I'm going to hang up here. We've spent nearly 30 minutes, and I hope you have gotten something worth your 30 minutes of your time. That's the way orthodontics is, and we need to learn how to do it. So I'm going to hush and close this up. Thank you for watching. And I want you to subscribe to our program. We need a lot of people that subscribe to this. Thank you now. Bye-bye.